What is a birthmark? The birthmark is a discoloration or mark that is present on a person's skin at birth or shortly after birth. It can be a variety of shapes, sizes, and colors and can be located anywhere on the body. Some birthmarks are benign and do not require any treatment, while others may be a sign of a more serious underlying condition and may require medical attention. A birthmark is a type of skin marking that is present at birth or appears soon after. They can be caused by a variety of factors, including genetics, exposure to certain substances during pregnancy, and other health conditions. Birthmarks can be classified into two main categories: vascular birthmarks and pigmented birthmarks. Vascular birthmarks are caused by abnormal blood vessels and can appear red, pink, or purple. They can include hemangiomas, a collection of blood vessels in the skin, port wine stains, a flat, red birthmark, and strawberry marks, a raised, bumpy birthmark. Pigmented birthmarks are caused by an overgrowth of melanocyte, the cells that produce skin pigment. They can appear brown or black and include moles, café au lait spots, and Mongolian spots. Most birthmarks are harmless, but in some cases, they may indicate an underlying health condition and require medical attention. A healthcare provider can help determine the type of birthmark and recommend the best course of action. Treatment options for birthmarks depend on several factors, including the type of birthmark, its location, size, and symptoms. Here are some common treatments for different types of birthmarks. 1. Vascular birthmarks. Hemangiomas. In many cases, hemangiomas will go away on their own. For severe cases, treatment options may include corticosteroid creams, oral corticosteroids, laser therapy, or surgery. Port wine stains. Laser therapy, such as pulsed dye laser, is a common treatment for port wine stains. The laser light targets the abnormal blood vessels and destroys them, leading to lightening of the birthmark. Strawberry marks. Treatment options may include observation, corticosteroid creams, or surgery. 2. Pigmented birthmarks. Moles. If a mole appears abnormal, it may be biopsied to determine if it is cancerous. If a mole is cancerous, it may need to be removed surgically. Café au lait spots. These birthmarks are usually benign and do not require treatment. However, if they are large or dark, they may be treated with laser therapy or topical lightening agents. Mongolian spots. These birthmarks typically fade on their own and do not require treatment. It's important to consult a healthcare provider for an accurate diagnosis and appropriate treatment recommendations for your specific birthmark. The healthcare provider can also discuss the benefits and risks of each treatment option. Vascular birthmarks can be treated for various reasons, including for cosmetic reasons, if the birthmark causes functional problems, or if there is a concern about the birthmark being a sign of an underlying health condition. Here are some guidelines for when to consider treating a vascular birthmark. 1. Cosmetic reasons. If the birthmark is noticeable and affects a person's self-esteem, treatment may be sought for cosmetic reasons. 2. Functionality problems. If the birthmark interferes with a person's vision, speech, breathing, or other daily activities, treatment may be recommended to improve functionality. 3. Concerns about underlying health condition. If there is a concern that the birthmark may be a sign of an underlying health condition, such as a vascular malformation or a rare genetic disorder, treatment may be recommended to address these concerns. It's important to note that treatment for vascular birthmarks is typically not medically necessary and is a personal choice. If you're considering treatment for a vascular birthmark, it's a good idea to consult a healthcare provider for a thorough evaluation and to discuss the various treatment options and their risks and benefits. The healthcare provider can also help you determine the best time to start treatment, taking into account factors such as age, location, size, and other factors. Treatment options for pigmented birthmarks depend on the type of birthmark and its symptoms. Here are some common treatments for different types of pigmented birthmarks. 1. Moles. If a mole appears abnormal, a healthcare provider may perform a biopsy to determine if it is cancerous. 1. If a mole is cancerous, it may need to be removed surgically. 1. In some cases, the entire mole may need to be removed, while in other cases, only a portion may need to be removed. 1. If a mole is benign, it may be left alone or removed for cosmetic reasons. 2. Café au lait spots. These birthmarks are usually benign and do not require treatment. 2. However, if they are large or dark, they may be treated with laser therapy or topical lightening agents. 3. Mongolian spots. These birthmarks typically fade on their own and do not require treatment. It's important to note that some pigmented birthmarks can be a sign of an underlying health condition, such as neurofibromatosis, a genetic disorder that causes tumors to form on nerve tissue, or von Hippel-Lindau disease, a genetic disorder that can lead to the development of tumors in multiple parts of the body. If there is concern about an underlying health condition, a healthcare provider may perform additional testing and recommend treatment as needed. In general, it's a good idea to consult a healthcare provider if you have concerns about a pigmented birthmark or if you're considering treatment for a pigmented birthmark. The healthcare provider can help you determine the best course of action based on the type of birthmark, its location, size, and symptoms. Is it a dangerous sign if my baby has birthmark? Having a birthmark on a baby is not inherently dangerous and is a common occurrence. Most birthmarks are benign and do not pose any health risks. However, in some cases, a birthmark may be a sign of an underlying health condition, such as a genetic disorder. It's important to have a healthcare provider evaluate any new or changing birthmarks, as well as any birthmarks that cause functional problems or affect a baby's appearance. The healthcare provider can perform a thorough examination and order additional tests, if needed, to determine if the birthmark is benign or if there is an underlying health concern. In general, it's always a good idea to consult a healthcare provider if you have concerns about a baby's health, including concerns about a birthmark. The healthcare provider can help you determine the best course of action for your specific situation.